Your doctor fitted you with a pessary and now you're petrified about removing it because you're so worried it's going to be painful. Breathe. I promise you it's much simpler and gentler than you're thinking it is. Let me show you the safest doctor-recommended method of removing a pessary. Hi everyone, I'm Dr. Nabila Noor, board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon, and welcome to our pelvic health community. Here we empower, we educate, we break down pelvic health myths so that you can learn about your body and make the best decision for yourself. If you're new to the channel, hope you like what you see, and if you do, don't forget to hit the subscribe button and do share these episodes with others in your life. So many women suffer in silence because they're not even aware that these pelvic health conditions exist and that there's a whole specialty that's built to help women suffering with pelvic floor issues. I once had a patient who came to my office so nervous because she was worried that the pessary that we inserted her with was stuck. She kept saying, "Dr. Noor, I swear I'm trying to pull it out and it's stuck." She was screaming with anxiety. Turns out it wasn't stuck at all. She was just pulling at it not in the right direction and not correctly. Once I showed her how to pull on it properly, it just popped right out and she removed it in less than 10 seconds. So let's take away the fear and guesswork and show you in a step-by-step fashion how to remove a pessary like a pro. So let's talk about things that you need before removal. Number one, clean hands. Remember, you don't need any special gloves. You don't need to go crazy with being sterile. The vagina is not a sterile organ. As long as you clean your hands with some soap and water and keep it dry, that's more than enough. Number two, get in a comfortable position. For some women, it could be laying down on their bed. For others, it could be sitting on the commode. And for others, it could be standing up with one leg on a step stool so you can access the vaginal area easily. Number three, sometimes some women may need a little bit of lubricant to help slip the pessary out. If that's the case, make sure you have access to some water-based lubricant so you can use it as needed. And finally, number four, relaxed pelvic floor. Easier said than done, I get it, but the more you stay relaxed, the easier it's going to be to take your pessary out. And if you're feeling nervous and anxious, take some slow, deep breaths till you feel your body relaxing, and that's when you go to take it out. Okay, so ready for the step-by-step removal? Let's talk about it. Step number one, locate the edge of the pessary. So for today's demonstration, just like we did for the insertion, I'm going to use a ring pessary with support. Now remember, the ring pessary has a little donut and then it has this support which has these holes. Usually what I do when I'm trying to remove this pessary, imagine this is the vaginal opening and the pessary is inside. So when I'm trying to remove the pessary on patients, first thing I do is try to identify where the edge of the pessary is. So then it's the step number two is I try to find that large circle and see I can hook my index finger into that large circle. So if you're looking at it like this, I try to put my finger in and hook the finger to make it easier to pull it out. Step number three, once I have my finger hooked, I kind of try to pull downward and forward, kind of like this, right? As opposed to just pulling it straight out, I kind of try to angle my finger and then try to pull it downward and then forward. This allows the pessary to tilt and also to collapse slightly so that it can easily come out as I'm pulling on it. If you're just trying to pull it straight out, it can be a little uncomfortable. And so sometimes I'll even have patients bear down and give me some pressure, so kind of like Valsalva, have them bear down as if they're having a bowel movement so that their pressure and me pulling can create a combined force that can help pop the pessary out. Number four, keep gentle, steady traction, because a lot of the times what happens is as we are pulling, if you're not keeping steady, gentle traction, if the finger opens up, the pessary can pop open and that can be really uncomfortable for patients. So make sure you're kind of pulling it in a controlled fashion. Sometimes I'll use my thumb and my middle finger to kind of use it to fold the pessary so that as I'm controlling it out, there's constant, steady pressure and the pessary doesn't really pop open. Number five, allow the pessary to come out at its natural angle. You shouldn't have to do much. If the patient is pushing and you're kind of angling it, tilting it down and forward and having that gentle traction, it should almost come out pretty easily. And you kind of just follow the curvature. And once the majority of the body of the pessary is out, it just pops right out. Now, sometimes if you feel like you're stuck or the patient's having a lot of irritation on the vaginal wall, using a little bit of lubricant, a water-based lubricant, can be helpful, especially if you put it around the edge of the ring, can kind of help slide it out a little bit easier. Nobody likes to have their pessary out, so the sooner and more efficiently you take it out, the better for everybody. So what should you do after you remove the pessary? Number one, you want to wash and clean the pessary. Just some soap and warm water is good enough. Make sure to dry it completely. Check for any breaks or any damage to the pessary. Also, inspect yourself for any irritation or any vaginal bleeding. When I'm taking the pessaries out for my patients in the office, once I remove it, I always do a speculum exam to make sure there's no bleeding, there's no irritation, there's no ulceration, especially patients who have had the pessary in for a long time. The pessary can rub against the vaginal walls. My postmenopausal women who already have very thin vaginal tissue may notice this even worse than the younger patients. And so that rubbing can sometimes cause discomfort, sometimes cause some ulceration, some bleeding, some discharge. So you want to make sure that there's nothing concerning, because if there is, you want to call your doctor and get an appointment for further evaluation. Maybe even consider doing a pessary break, which means you're keeping the pessary out for a few weeks and letting that area heal before you reinsert the pessary back in. So when should you not be removing the pessary yourself? Number one, if you're pregnant. If you're pregnant and need a pessary for whatever condition, always a good idea to follow up with your physician to make sure they're always doing an exam, that there's nothing concerning. And you also don't want to be bending over with a gravid belly or a pregnant belly, because that can also be uncomfortable. Number two, if you feel that you cannot reach the pessary or you're pulling at it and it's not coming out, stop, call your doctor. Number three, if you're experiencing sharp pain and bleeding. Many of my patients, if you're experiencing sharp pain and bleeding, removing a pessary may not be the most comfortable thing, but if it's done correctly, it should come out pretty easily. If you're struggling or having difficulty and feeling pain and discomfort, then again, stop, call your doctor. Number four, if your doctor advised you not to remove it by yourself. There are certain kinds of pessaries, for example, the Gellhorn pessary or a cube pessary, which can be really difficult for patients to remove themselves. So if you're somebody who has been fitted with a Gellhorn pessary or a cube pessary, chances are your doctor will tell you that when you have to get it removed, you follow up with your physician so they can remove it and then reinsert it to make it easier on you. One pro tip that I will give you, I've actually had some patients who tell me that they've tied a little rope or a little string through this, and the end of the string or the edge of the string actually kind of hangs out through their vagina. And the idea is that, sometimes it may be difficult to find the edge of the pessary. So when they have that string, they can kind of use that string and then pull on the pessary so that the pessary can come down, and then they can find the edge and hook their index finger. Not for everybody, and many patients may not even need it, but if you feel that you're always having a difficult time to find the edge of your pessary, maybe something to think about. So there you have it. Hopefully this video and the other video that I made about how to insert your pessary safely together will make your pessary journey safer and easier and trauma-free and pain-free. If you liked today's video, don't forget to hit the subscribe button. And in the next week's video, we'll be doing the final video of our pessary series, where I'll be talking about some pessary problems patients often encounter. When it's too big, when it's too small, why is it not staying in properly? Why are you bleeding? And what should you do about it? So many women ask me about non-surgical treatment options for their prolapse or urinary leakage, and a pessary for the right patient can be a true game changer. So hope you can use this information to make your pessary journey safer. I will see you soon. Till then, stay well, stay safe, and don't forget to take care of your pelvic health. Bye.